was like, wow, I would have a bigger impact than just doing occupational therapy because I would probably see like maybe 300 patients a year, depending on what clinic I'm at. But with public health, I'm touching communities. Like I am touching populations. Like I'm making a difference when we have a pandemic or when we have issues with health equity or we have issues with somebody conquering their barriers with their SDOHs or or so on. The list keeps going on and on and on. And with occupational therapy, I feel like I was in a box. I feel like there was no room outside of that box. And when I feel like I'm in public health, I feel like my circle keeps getting bigger each time. Like there's so many different avenues of public health. And when he shared that with me and I did my own research and dug deeper into it, I was like, yep, this is for me. Yep, I'm going to apply to, this school, this school, this school, because, and also too, I love the missions that the schools I apply to in their public health and what they did in the community as well.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all.
Hey friends, welcome to Public Health Careers. In today's episode, you'll hear more about working as a community health worker as well as a program manager in the same role combined. Interesting but insightful once again. The important role that a gap year can play in really solidifying what you want to do in your career, as well as getting tangible skills and experiences that you can apply to a master's program or your future career endeavors, as well as navigating your path and just understanding that you shouldn't worry about other people's path because your journey is your journey and you're going to get to where you need to get to the way that is designed for you. So just be sure to believe in yourself and make the decisions that are best for yourself in your journey. If you enjoyed today's content, all I ask is that you hit that subscribe button, leave a review, and share this with someone who gets some value from it. This is really the best way to support the show and to get the show out to more people and help them navigate their public health careers as well. As you know, it's a broad field with a lot of different ways that you can navigate it. So be sure to subscribe, leave a review, and share it with someone. I greatly appreciate that. Enjoy the show.
Hello, everyone. This is Taylor Humphreys, and I am a community health worker and a program manager at Bond Community Health Center. And I'm also an adjunct professor at Florida State University, and you are listening to Public Health Careers.
Today, we have someone who's working towards implementing policies to grant access to quality healthcare for people of color. She got her bachelor's degree in health services, allied health, health sciences at Florida A&M University. She then worked for about 2 years as a department secretary at Tallahassee Memorial Healthcare, then went on to get her Master of Public Health at Florida State University. She works as a community health worker and NHCI SHBP program coordinator manager at Bond Community Health Center. She's also on Instagram at Black Women in Public Health and host of Black Women in Public Health podcast. We have Taylor Humphreys, MPH. Welcome to the show.
Thank you for having me. I appreciate it.
It is my pleasure. I feel like it's been a minute since I've had someone that I'm connected with on the Public Health Millennial on Instagram on the show. So I'm excited to have another Instagram social media person here as well.
Awesome. I'm very excited. I do listen to the podcast often when I do get a chance. So I do enjoy it, and I'm actually very happy to be here and share my public health journey.
Well, I appreciate that. And if you're listening to this first time, be sure to subscribe as well. That definitely helps the show get out to more people. But that also always means a lot when someone listens to this show. So I appreciate that. And yeah, I know the episodes can be long sometimes. So whenever you fit that time in, definitely tune into the episode and take it in. So I appreciate you on that. Yeah.
Of course.
So tell us, how do you identify, and tell us a little about your personal background?
Alrighty, so I can say that my pronouns are she and her. My background, I went to Florida A&M University. I wanted to be an occupational therapist at first. I've always had an end goal of helping people, so I sought out occupational therapy. But then I kind of got a little discouraged on how competitive OT school was. And then I felt like wouldn't have a huge impact in the community, just maybe on a smaller scale. And when I did meet one of my professors after school one day, I always give him credit because I wouldn't be the woman I'm in public health today without him. Dr. Michael Smith, he was one of my professors at FAMU, and he shared with me what public health was. And after that conversation, it was different ever since. I looked at the world a different light. And so I did apply to 3 schools. I got into all 3. I applied to Florida A&M University Public Health Program. I also applied to Morehouse School of Medicine's program. And then I applied to Florida State. All of my options were great, but I did want to be financially responsible. So I did choose Florida State. Florida State is a PWI located in Tallahassee, Florida. I completed the program within 2.5 years, and my background is in health policy at Florida State.
Okay, I appreciate you sharing that. Are you from Florida originally?
Yeah, so I'm from Orlando, Florida, born and raised. I stayed there for I stayed there all my years, excuse me. And then I first went to Barry University. I wanted to go there for nursing, but then I tried to, I switched my track up a little bit, and then I transferred to FAMU.
Okay, and we'll talk a little bit about more of that process in just a short little bit.
Oh yeah.
Yeah, and you alluded to it just now. So you're a Black professional teaching at a predominantly white institution. Can you tell us more about that experience or like the thought process there?
Yeah, so when I was a little girl, I was one of those girls that would set up like different papers inside the bedroom and try to, pretend like I was a teacher. So I always had that drive within me. I graduated from Florida State in 2021 December, and I actually was asked to teach back at the school. I thoroughly love Florida State. Florida State, again, also made me who I am today. And teaching at a PWI has actually been a really great experience. Just being able to be a role model for the Black kids on campus, especially the Black women that I encounter. I love to give them something like, oh, hey, I can really do this, and, show that their things are possible. It's been a really great experience just teaching there, and being able to be a role model for the Black women on campus, and also the Black males as well. But just being able to make an impact culturally, because, of course, going to a PWI, there's not a lot of people of color presence, and they don't have a lot of people of color that are instructors. And me just being one of them and being a graduate of the school is just really empowering. So I'm able just to pour back into Florida State how it poured back into me.
Love that, and I think that that's important. Whether we at a PWI and whether you categorize it as a PWI, I like to think of it as a HWI, historically white institution, but that's neither here nor there. But I think right. I think it's important to as you said, like you went to the school, you knew the kind of experiences and people that you were able to see in professor roles, and you wanted to make an impact and like kind of show up for the Black women and men in the school in a meaningful way, and you saw a way to do that as an adjunct professor, which I think is awesome. And I'm looking forward to getting more into your thought process of wanting to become an adjunct professor a little bit later on. But before we get into any of that collegiate journey, what does public health mean to you?
Oh, honestly, public health to me, it really means providing education so that the population can have longevity, especially when it comes to health. Being a community health worker, my main job is to eliminate SDOHs. And SDOHs is the social determinants of health. And that's like a big part of public health, because how we pray, eat, sleep, work, live, that's all important. And so when I think about public health, I really think about those social determinants of health and how can I really help my community and alleviate those social determinants of health that are really barriers for some people, especially people of color. I feel like public health is also so passionate to me is too, because amongst the colored community, I feel like it's a taboo topic that we're still trying to navigate through. And I'm just so passionate about it that I really want to provide all education that I can to help people understand public health.
Yeah, absolutely, and I appreciate that. I like the thought process of both like the longevity and the social determinants of health. Because when I think about like longevity, I think about living a long, healthy life and like just being able to do the things that you love as you age and as you live your life. And as you said, like those social determinants of health are the things that definitely impact our health, and especially as people of color and as populations of color, they have been disproportionate ways that social determinants of health have kind of affected us, and we need to kind of like take charge of that so that we can live healthy lives. And as you also said, I think it is kind of a tough topic to talk about in a lot of spaces, and just finding ways to talk
Yes.
about it, because it definitely is not easy. And I think about I think it's called the Black Joy Fest, which is held by Black
Yes.
Health Commission in Orlando, Rebecca and her
Mhm.
team, which I think is a great way to incorporate that into the work. It's like people are already doing these types of things. How can we incorporate what they're already doing and making that like a health opportunity or health education opportunity to get those populations kind of
Right.
just more talking about health. So that's awesome, and I love that definition.
And I like how you brought that up because that's why I did choose Florida State because it does focus on health policy. A lot of public health programs don't focus on health policy. That's kind of usually on like the doctoral level or the PhD level. But that is why I did choose Florida State because, you know, with policy, you create change. And I do feel like the healthcare system was set up to disproportionately affect people of color. Um, because if you look at it now, all people of color, you know, those demographic groups, you know, they're affected by the healthcare system. Either it's too expensive or they're not getting the best quality of care, you know, things like that. So that is another reason why I'm very passionate about it, because I do want to get to a higher level in my career where I do create policies, I do create, you know, more laws and regulations and having more stakeholders behind me and lawmakers, you know, to help me out to, you know, create more change and, you know, give more people opportunities. And I always don't want to focus on people of color, but you know, let's just be real, we're disproportionately affected by our healthcare system. But I do always emphasize health equity when it does come to everyone in public health because everyone does deserve health equity.
Absolutely, and I think that is something that you see very often is people like understanding like there's this behavioral aspect of it, but it's like how do we change the policies and systems around it so that the behaviors kind of go in line with that. And like to your
Absolutely.
point, the systems whether intentionally or not intentionally have been set up to
Essentially,
give the
yeah.
outcomes that they give, right? And we
Yeah.
need to be people that we can advocate for those changes and like understand it and then work towards it. And yeah, policy changes is definitely a good way to do that. So I look forward to seeing how that evolves in your career and how you're able to make that impact as you grow as well.
Thank you so much.
You're most welcome. And like bringing you back to the beginning of your career, so you said you got your associate's degree in general biology at Barry University, I believe it was. So tell us about the thought process in that.
So I had a lot going on in my career life. So I did go to Barry University initially because I wanted to be a medical examiner. But I did transition from Barry because Barry is a great school, but it was a little expensive because it was a private institution. But I initially went into biology because again, I want to help people. I knew that was my sole purpose in my career, and did want to be, like I said, a medical examiner. So transitioning from Barry to Florida A&M University was just a better opportunity for me. But I thoroughly enjoyed my time there. And also too, I wanted to get away from being at home in Orlando. But that is how I ended up at Barry.
Okay, yeah. Looking for a little more independence, which makes sense. Hey, no complaints there, complaints there at all. Can you tell us more about, or if this was something, because you said that you knew that you wanted to help people in your life, and like you saw that initially as being a medical examiner. So where did that like thought process of wanting to help people come about, if you can remember?
As a little girl, I would have always just been, my mom always tells me that, you know, you always been a giver. And I've always had a big heart, especially for homeless people, especially people who were less fortunate than me. Because when I was a child, I didn't have to want for anything, but my heart literally goes out to people who don't have anything. And I think it began while I was at church, because we used to have homeless people come to our church, and I would give them, I would beg my father to give them some money, or, can we get them some food or something? And I think me just seeing that so early on as a child, that was just so instilled into me to always give my all to others who don't have anything. And sometimes it may get me a little in trouble, but that's why I just love what I do, because currently also as well, I serve homeless people. I serve a homeless population. So I still have that within me. But I know that's never going away. And that is why I tell people in public health, you have to be passionate about it. And I think that's why I'm very passionate about public health, because my heart is so in it, because I know that with public health and me doing what I'm doing, I can truly help so many people. And that's why I'm thankful that this career field did align after all of my transitions through my career. I'm glad that I did land here.
Yeah, absolutely. Public health is a great place to be if you're trying to
It
work
is.
towards improving populations and health. So we love to
Yes.
see that as well. Um, so tell us a little bit about because you transferred from Barry to Florida
Hmm.
A&M. Did you when you transferred, did you go into it as a bachelor's in science and health services, allied health and health sciences?
Yes. So it did take me a little longer to complete my bachelor's, because I did switch in between schools. But I am thankful for the transition process that I did have, because Barry was private and I transferred to Florida A&M, which was a public school. I did have to redo some classes, but I'm thankful that I did, because I was able to get more education on the topics, like anatomy and biology, botany, and things like that. So I was able to learn more at Florida A&M University. And I chose Florida A&M because it was at HBCU, and a lot of my family members went to Florida A&M, and I just was more attracted to the culture and the school, and also the allied health science building. And when I found out about occupational therapy, it was kind of one of the best programs within the school. I mean, within Florida, excuse me.
Yeah, that makes a lot of sense, and I can imagine just how beneficial. Like you're here to retake classes, but I feel like many times you take classes and you're kind of naive to it, or you're like just trying to get through it and not really absorb the information. So it just gives you another opportunity to kind of dig deeper, as well as I guess a refresher on the information, which is never really a bad thing. So I
Yeah.
understand that.
And to anyone watching this, don't be discouraged if you have to switch schools to get to the career that you want, especially with public health. And well, a lot of schools are adapting programs now since the pandemic, or, providing certifications, or somewhat of something of public health. But don't be discouraged if you have to switch schools, and if you get further back in your career, or, things like that. Even if you didn't start in public health, don't be discouraged. It's all going to be well worth it, because I can say I'm glad that God directed me this way, because I've met a lot of people, made a lot of connections. I've met you on LinkedIn, just things like that, just meeting a lot of people in the community. So don't be discouraged. The time is coming.
Absolutely. Your journey is unique to you, and there's no right way to get to where you have to get to. So just really
Absolutely.
believe in yourself. Yeah, because many times we do get discouraged from taking those steps where we think it's like, oh, we're going backwards, but it's not really backwards. It's just like part of the process. It's a step along the journey to get where you need to go. So just believe in yourself and make those conscious decisions as best as you can with the information that you know. Were there any undergrad takeaways that you wanted to share with us?
Yes. Um, do not be discouraged if you do not use your bachelor's degree. If you find another passion, it is okay, especially if it's something that you are truly passionate about. I was passionate about occupational therapy in my undergrad. That is what I graduated with. But I started to get discouraged because of how competitive it was. And I want to say, do not be discouraged by other people's journeys, because your journey is your own. But, you know, it's important to just recognize the best parts of your journey and learn from them. For me, I had to learn patience, and I had to learn determination. Um, I had to be patient, because while we talked briefly in the beginning how I worked at TMH for 2 years. before I went into grad school. And during those 2 years, I had to learn patience of what I wanted to do with my career. Because, when you graduate from undergrad, there's this thing called post university depression. And I felt like I diagnosed myself with that. And I was depressed because I didn't know what I was going to do next. And so do not be discouraged if your journey changes. And sometimes it's the best when your journey changes. For me, that's how it was. So while I worked at TMH for those 2 years, that was like my groundwork and my me building up my determination for what I was going to do next. Because I knew what I was going to do next. I was going to have to stick with it, be patient, and push through. And I'm glad that I was patient and I pushed through because I am who I am today because of that wait time during those 2 years. So that is my takeaway from going from undergrad to graduate school. Just be patient and just stay determined. Just stay hungry, stay focused, and it's on the way.
Yeah, absolutely. And I could imagine that post-graduation depression, especially when like you have this
Yes.
ideal of where you're trying to get to, and you mightn't have gotten there at that point in time, and you're feeling like, oh, you're behind, or you're just like comparing yourself to others. But as we
Yes.
said earlier, it is your own journey. There's no need to compare yourself. It is not a race. And you have to do what is best for you and navigate your path as best as you know at that point in time. So I appreciate you sharing that.
Absolutely.
And I also want to highlight the point of like you going into your associate's program at Barry University, wanting to become a medical examiner. Then you want thinking about becoming an occupational therapist, and then you're like, okay, is this really what I want to do? And then like taking that time and taking that gap year to figure out what it is you wanted to do, because I think too many people they finish a bachelor's, they might go into that depression and like what's next without giving themselves time to like reflect and see, is this actually what I enjoy doing? Is this something that I can see myself doing? Are these skill sets like something that I want to build on? So just really being cognizant of that, I think is very important. So I appreciate you sharing that.
Absolutely.
And tell us more about that thought process in wanting to take that gap year. Was it something that you actively thought about, or was it that you had this post grad depression and you're like, okay, I'm not too sure what I want to do right now. Occupational therapy school looks hard to get into at the moment. Let me take some time to do this work to figure out what other opportunities are out there where I can really still help people.
My thought process behind it, I really did want to take my time, just because I've seen some burnouts from some of my friends going from undergrad straight into graduate school. And I get everybody has like a timeline of when they want to finish school, but I really did want to give myself a year break. It extended to two because I was still battling of what I wanted to do with my career. But really extend yourself some grace. Burnout isn't ideal. I get some people want to go to medical school, in between those times, because I do know some people like to get their MPH before medical school. But I also do feel like as though people need a break, especially for your mental health, especially preparing for the public health field, because I do feel like public health is very rigorous, it's very fast paced. So I do feel that everybody should give themselves a break in between. Give yourself a gap year at least, especially, take an internship or a fellowship or something to go towards public health, just so you can get an inside scoop of what to prepare for. But definitely extend yourself some grace if you can, because being in grad school, I cried a lot writing papers. Um, it's a lot of time management. Sometimes you can't even have a job. You can't even see family. You can't even see friends because you're studying or you're preparing for a practical or your dissertation or your capstone, whatever your school may ask you to do. So definitely send yourself some grace if you can. That's what I recommended for myself.
Grace is definitely very fundamental, and knowing that there are
Yes.
sacrifices that are out there when you're doing this work. But yeah, taking your time. There's no need to rush, especially with a big decision and a big investment like a master's program,
Right.
into rushing into it. So I definitely advocate for that, especially if you don't know what you want to do next. Like take time and reflect
Yeah.
and do those internships and talk to people on LinkedIn and whatnot, and just really, really get a better idea of like what you can do moving forward.
Right.
Okay. And what kinds of things did you do while you were at department secretary at Tallahassee Memorial Healthcare? Was it just more like administrative
Ooh,
stuff?
everything. So I did work overnight, so I got like some of the action, which was pretty cool. So in public health, my end goal is to do research in breast cancer. And so I thoroughly loved, I took the position I took because it was on the Angie Debbie cancer floor at Tallahassee Memorial Hospital. And there I was able to see different cases, and it just wasn't about breast cancer. I saw skin eating bacteria, I saw jaundice, I saw someone at the end stages of of end stages of AIDS. I've seen, I was even able to put my hand like this inside of a man's back because his bed sore was that big. So I came across like a lot of cases at TMH. I'm very thankful for TMH because it kind of prepared me for the job that I am in. I learned a lot of medical terminology. I learned how to work with families. I learned how to work with patients. I kind of learned some ways to how to get patients to be compliant. I've learned, what symptoms to look for. Even though I'm not medically licensed, I can still provide clinical education or look for clinical signs and things like that. So I'm able to look to see if a patient is not well. I know kind of how like a doctor operates, a nurse operates. So working in the hospital actually gave me the foundation for my career today, which was really good. So I do recommend anybody, if you're able to even just volunteer at the hospital or even get like a secretary job, because secretaries do a lot. And I just didn't do just secretarial work. Like I transported patients. I actually cross trained to be a phlebotomist at the time. I also helped with like um, babysitting patients that needed help. So that also helped me as well because I was able to, communicate with someone that was having mentally health challenges. That's also a topic that's becoming, more apparent in our society because mental health has always been like a little taboo topic. But I'm thankful for that job as well because I was able to, learn how to talk to those patients that have behavioral health issues. So I can say TMH did set the foundation for me, especially in my healthcare career. It gave me a lot of medical terminology. I met some doctors in the community that I still work with today. So just knowing people who are in your community, especially at a hospital, is really good because you'll be able to, refer somebody in the community to them, or, you just know where some resources are. And I feel like being a public health professional, it's your job or at least your essential duty to know resources in the community that you can, send somebody to, especially when they're in need. So work at a hospital if you can.
Yeah, and I think everything you said there just kind of speaks to the value of taking that gap year or like just getting experiences where you're able
Oh
to
yeah.
interact with a lot of different systems. Because if you were to go straight from that bachelor's into that master's, you would have none of that kind of context or experience, which I think is very
Mm-mm.
important to think about. And as you said, yes, if you're looking for something, definitely internship at a health system, hospital, or health department are ways to definitely get a
Mm-hmm.
lot of different insights into the field of public health. So that I
Absolutely.
appreciate you sharing that. So you got your master's of public
Of
health at
course.
Florida State University with a focus in policy.
Yes.
When before like
Yes.
when did you find out about the word for public health? Was that because I know you did a sort of health sciences, health services bachelor's degree? Did you learn about
Mhm.
public health then, or when did public health come up for you?
So in my gap year, when I was confused of where I wanted to go, I met with one of my professor, Dr. Smith, and he shared public health because he has a doctorate in public health. He actually went to FAMU. FAMU has multiple tracks with their DRPH program. They have behavioral health sciences. You can do statistics or epidemiology. So I hope I'm not misquoting, but I believe he did biostats. But he just shared with me, he was like, "Hey, do you know what public health is?" And I was like, "No, I really don't." It was never heard of it in my life. And so once he shared with me, he shared some of the projects his students were working on, shared some of the schools that they were going to, and shared some of the work that the school was doing directly in the community. I was like, wow, I would have a bigger impact than just doing occupational therapy because I would probably see like maybe 300 patients a year, depending on what clinic I'm at. But with public health, I'm touching communities. Like I am touching populations. Like I'm making a difference when we have a pandemic or when we have issues with health equity or we have issues with somebody conquering their barriers with their SDOHs or some, or so on. The list keeps going on and on and on. And with occupational therapy, I feel like I was in a box. I feel like there was no room outside of that box. And when I feel like I'm in public health, I feel like I'm in my circle keeps getting bigger each time. Like there's so many different avenues of public health. And when he shared that with me and I did my own research and dug deeper into it, I was like, yep, this is for me. Yep, I'm going to apply to, this school, this school, this school, because, and also too, I love the missions that the schools I apply to in their public health and what they did in the community as well. So hearing public health from my professor really trajected my public health career. Um, so I'm very thankful that, I did go to him in my time of need. He did give me great advice and he did, share a career with me that he knew I would be passionate about. He just didn't share a career with me because it made money or, it did this, this, and this. I shared with him what my end goals were with my life and my purpose. And he perfectly aligned with me with public health. So I'm glad public health came about because, again, I would not be where I am today and touching as many people as I am now.
Yeah, I absolutely love that. And I think it just goes back to the importance of having people in your life that have experiences and exposure to things that you may have no
Yes.
idea about, and like kind of just leaning on them for information and then seeing if it is something. Because yeah,
Mm-hmm.
many of us listening to this podcast right now had no idea what public health was until very, very late into our careers. So I'm glad that we are able to talk more about it and share more about the different journeys that you can take in public health and that kind of population health impact that you can make, because definitely very important. When did you decide that you were not going to go to occupational therapy school, but you would go and complete a master's of public health?
As soon as I got my first acceptance letter. Because the GRE is something that you do have to take. Well, now thankfully some schools have dropped the GRE requirement for public health schools. So when I found out, like I said, OT school was very competitive. And so you had to have a 300 plus. I've not always been a good test taker, and it's okay for me to admit that because everyone is not, and everybody cannot admit that. But I'm happy to admit that because I know there's others out there that's like me. But the GRE was very challenging. I'm not going to even, lie to you. It was very hard. It was rigorous. And with the score that I did get, I was able to get accepted into all three of public health schools. Excuse me. Um, so, like I said, when I got that first letter, I was very excited. I was like, yeah, I'm ready, ready, ready. So as soon as I got that, I knew that that was for me. I believe in God a lot. I believe that He does know the plans for my life. So that's why I can say that I knew when I got that first acceptance letter, and it was within a month and a half or 2 months that I applied, and I didn't get a denial letter from OT school till 6 months later. So it was just right. As soon as I read the letters, congratulations, it was okay, I'm going. Like, and my mom always wondered, she always was like, you were so passionate about occupational therapy school. You were so passionate. And I'm like, yeah, mom, but being in public health, I would touch more people than I would in a clinic or being at a hospital or maybe having my own practice, And I'm not discouraging the occupational therapy field because honestly, it's still a great field. They help people navigate through life, especially through their occupations. But with public health, I just felt more passionate about it. Even though I didn't know a lot about it, I felt more passion towards doing that than occupational therapy.
And I think that point of your mother, because I had a very similar experience. Well, firstly, I would say that I'm glad that you got into your public health program, and they're like, "Oh yeah, hell yeah!" Because for me, it was a complete opposite. I got 3 rejection letters from Masters in Medical Sciences program, and they're like, "Oh crap, what do I do now?" And I got it, and I applied to public health programs. But that's neither here nor there. But
Hmm.
I think it's also very important for us to because many times we do express earlier, okay, I want to be a doctor, I want to be an occupational therapist or whatever, and then that's like the ideal that people hold us to and say, oh, that they're going to be this, they're going to be that, and then as we live and we learn and we have more experiences, our perceptions of things change, and it's hard for other people to kind of also see that change and accept that change. So I'm just saying that for anyone out there who wants to do something new and someone is telling you, oh, but you want to do this, like it is fine, it is superpower to change, and you have to have strength and know that like this is what you want to do because you have understand that in your life you want to make this type of impact, and this is the way that you've seen people make this impact and going along that path. And I think like the bigger point there is like just understanding, having that bigger value in your life of wanting to help people and knowing that you can do that in a multitude of ways, and just being able, I think like finding public health, because it's Public Health Careers podcast, finding public health is always a great way to make that impact in improving people's lives, and there's no right
Yes,
way to get there. So I really appreciate that, and I appreciate you sharing.
of course.
Yeah. So tell us more about you spoke to it a little bit earlier, but the choice of choosing the policy concentration.
Okay, so when I chose my public health schools, like Florida A&M has 5 tracks, so they cover majority of the tracks that a lot of schools cover, like health behavior, epi, biostats, health behavior, maternal and child health. And at Morehouse School of Medicine, they had about the same tracks as well. I can't remember verbatim, but it was kind of fairly new. Their public health program was kind of fairly new when I applied. And then Florida State was health policy. When I looked at health policy and just looking at the different backgrounds, I really wanted to navigate towards more so health behaviors. So I was really up in the air with choosing FAMU or Morehouse School of Medicine, just based on their curriculum. And because health behaviors really matter, right? Health behaviors is why somebody does something. So if you want to figure out why somebody is obese, well, why does that food make them want to keep eating? Or what stressors or what barriers are they facing that continuously want them, to eat, or, what's keeping up their obesity? So I was like, okay, that's good, right? But how can I make a better impact? Policy. Policy is the start of how something comes into form. So, and also, I also need to share this as well. I teach health policy society at Florida State University. So I was very happy that I got that class because I'm teaching students on how to, create policy. But we'll dive into that later into this interview. But I just had to share that. But with health policy, it drew me so much to Florida State because I know that with creating policy or changing policy, I create change, especially when that change benefits people who are disproportionately affected by the healthcare system. And as I grew more into the program and learned more, I learned that, it's important. Policy is important because, again, that's how things start. But you make change with policy and you create better opportunities for people, especially when, again, they were disproportionately affected from the start. I feel like the healthcare system was created with policies that disproportionately affected different people. Um, and so with me doing that, and as I advance through my career, I'll be able to continue to make change and create more opportunities for people who have been disproportionately affected. So that's why health policy drew me more, because again, with policy, you create those changes.
Yeah, makes sense. And I think like understanding
Yeah,
fundamentally that like the policies around us are what shape the decisions we make, and all
correct.
those things kind of like trickle down from that policy level, understanding why it's so important. So I appreciate you
They
sharing that.
affect our SDOHs. They affect, just how we just navigate through life. And it just, affects really, the quality of care that you're given, or the access to care, or the cost. Think about the iron triangle when you think about public health. It matters. And that's, again, why I chose my health policy, because I'm trying to break those barriers down.
So during your MPH program, you had a couple positions. I'll name them out, and then you can talk
Yes.
about the experiences. So you were a medical scheduler at Women's Imaging at
Yes.
Radiology Associates of Tallahassee, as well as a graduate student intern at Leon County Health Department, and you were
Yes.
also certified in phlebotomy technician.
Yes.
So tell us about those experiences.
So I was working. So typically, some graduate programs won't let you have a job. So I tried to hold on to my job as long as possible. Working at Women Imaging it's a radiology facility. So we did all X-rays. I helped with out a lot of biopsies, and different other exams that we had. So I tried to hold on to that job as long as I could until I got to my second year when I had to take a class that was during the day and my job was not going to accommodate me. Um, but it was a challenge trying to balance working full time and being a full time grad student, especially how rigorous the FSU program was. So I wouldn't say I don't recommend having a job during your grad school career because, of course, everybody has bills to pay. You know, bills always keep coming. But if you can find a job that will benefit you educational wise, maybe like an internship or something like that, that would be more helpful. But I did enjoy my time there. While I was at Florida State in my grad school program, I did hold the position of community outreach coordinator with the Masters of Public Health Student Association at FSU. So that was really good. That gave me the foundation that I needed to do the job I am in now. I'm a community health worker. And just to working with the community outreach position, I was able to reach out to different community partners. We were able to volunteer with them, get more insight to public health. We were at DOH a lot, Department of Health, learning a lot of things. So that was pretty cool. And then while I was in my program, I did do an internship at Florida Department of Health. So I worked with the Florida Breast and Cervical Program. It's a program where they provide healthcare services for screenings and pap smears for people who are 50 to 64 and who meet that 250% poverty line. So when you meet that 250% poverty line, you're looking at somebody that makes about $10,000 or less. So that's somebody that doesn't even work at McDonald's because McDonald's even pays more now, you know? So it's just somebody who basically just makes nothing. So again, throughout my career, I've talked about women's imaging and I talked about working at TMH. And so that's why I really was focused on being intentional about doing my internship, something that involved cancer, especially breast cancer. So that is why I did choose that internship. And I actually got my internship through women's imaging. And so I do want to say this, do not be scared to ask anybody for an opportunity. I've always been a timid person, but something within me told me to ask the lady I was on the phone. She was the coordinator for the program. And I was like, hey, I'm about to start my internship. Do you guys have any internship opportunities available? And just like that, I was able to get get my internship. And so it was really helpful because I already knew what they were calling us for. So I was able to even help them even more. So I even helped them on the back end of, some of the things that I learned at Women's Imaging and made their process even more easier. And I did my internship for about 3 months. So I helped a lot of patients get their pap smears and their cervical cancer screenings and their breast cancer screenings. I helped do a lot of work in the community, working with other community partners that they worked with. And one of the community partners they worked with is where I work at now, Bond Community Health Center. And we were doing a breast cancer event here. Again, do not be scared to ask for any opportunities. I saw one of the managers that my preceptor knew, and she was like, hey, she needs a job. She's about to graduate. Do you guys have anything for her? And I was like, I'm very, I would love to work here. And so my internship, we were supposed to do a PowerPoint presentation for Bond Community Health Center just to re-educate the new employees on the program. And thankfully, the CEO was there, and thankfully, I was able to get a job. So again, your journey is not going to be perfect, but you will always end up where you need to be. And so I'm grateful for all the gap year that I took. I'm grateful for the entry level jobs that I had in between because it really built the foundation of my public health career and to where I am professionally.
Love that, and I love just like the interconnectedness of the story, and as well as yes,
Yeah.
I agree with you. Like, ask for what you want, share what you're thinking about in your career, because you never know who is able and willing to help you and assist you,
Who's
and
watching, who's listening. Yeah.
yeah, yeah, absolutely. So that's awesome. Um, did you have any Masters of Public Health takeaways that you wanted to share with us?
Ooh, take breaks if you need to. Not to be a little down, but so my uncle passed away in my program while I was getting my internship. Um, and I recommend taking breaks because I didn't want to. My program director actually had to force me to sit out because I wanted to keep going. I've already delayed my career, waiting those 2 years in my gap year, I wanted to catch up to some of my colleagues, but again, your journey is your own. So take breaks in between if you need to. Um, because you don't want again to get burnout in this career because this career will always be fast paced, fast moving. And so you want to be gentle with yourself. So that is what I really want to leave with is be gentle with yourself because you're going to encounter different people day to day that have maybe worse predicaments than you, so you want to definitely give yourself grace so that you can show up for those people, um especially when it matters. So grant yourself grace and network. So actually I have two things. So network as well. Networking is the most powerful tool that you can have. So your network is your net worth. My mentor has told me that, and I repeat that a lot. And it's important for you to know because like for you, for example, I know that you have interviewed a lot of people that you can possibly connect me with further on in life. So definitely utilize your LinkedIn. That is how me and Omari came across each other. So definitely utilize your LinkedIn. Keep and I'm gonna keep adding. So three things: be and always be professional. Always make sure that you are, crossing your T's and dotting your I's. Just making sure that you hold a good name in the community so that people can trust you, and also to just really depend on you when it matters. Because and have a heart for it as well.
Yeah,
Sorry that I added
absolutely.
all those things in for y'all, but yes.
No, that's good insights for everyone there, and I think people would definitely appreciate that because that is great advice. And one thing I just add, and I guess it's like a overlay of everything you said there. It's like you never know who's watching you, so as you said, like show up as
Yes.
best as you can and do the best work that you can because you really never know who's watching you and what opportunities can come from just day to day things that you think are mundane. So do the best that you can all the time.
And public health professionals are like everywhere now. You have them at Amazon, you got them at Walmart, you got them at Best Buy. And like that's one thing I can say I really love about public health. And not to say that the pandemic was a good thing, but it also kind of was like a good thing in a sense of way for making people more aware of what public health is and why they need them day to day in their facilities and at their organizations and things like that. Because like during the pandemic, Amazon faced like a greater loss with a lot of their employees being sick. So now they have public health experts like on site, to alleviate those things and to making sure that they're looking at, all the logistics within the building, making sure people are healthy and staying up to date with like vaccines or, their physical annual exams or things like that. So I like where public health is going. I can't wait to see where it is in like the next, especially by 2030 with Healthy People 2030. I'm excited to see, where we are there if we are close to, being more healthy as a country. But public health is definitely changing. It's definitely on the up and up. It's not just like a small piece of the conversation now. It's really like the big piece of the conversation now. And, public health experts are like really giving their opinions. Even in my job now, my CMO, our chief medical officer, was actually happy that my background was in policy because I've been able to shape some of our policies within our organization. So, public health people are being asked about their opinions a lot now. So it's definitely a great field to get in. So I definitely say, dive in when you can.
I absolutely agree with that, and yeah, that's really cool to hear. And I also advocate for that. And I think like because when a lot of people hear public health and they think like traditional public health, but I think when you think about public health in today's context, you're really thinking about public health skill sets and what skill sets are you building? Because as you said, there are all these like non-traditional public health organizations that have public health type
Right.
roles, whether that is an Amazon or whether that is a Marriott or whether that is a Disney cruise line. There's so many different opportunities that are coming open for people with public health degrees and public health expertise. So don't limit yourself. There are so many opportunities, and I feel like there are going to be opportunities to create new roles and make what we
Mhm.
need of public health in the future. So yes, could totally agree with that, and I look forward to see what like where public health does go, and as well as us improving population health, especially those that
Yes.
are disproportionately affected by the SDOH's social determinant of health and other systemic issues.
Yes.
Yeah. So after you graduated, you became a public health case investigator at Kansas Department of Health and Environment. So how did you come across that? What did you do? Did you move to Kansas?
No, so that was a contracted job I actually took during the pandemic. Um, and it was actually a great opportunity to take it because I did learn more about pandemics. I learned more about vaccination uptake. We were able to look at some of the information that the epidemiologists shared that they had on the team. Um, and it helped me also to learn more how to talk to people as well, how to handle the HIPAA, how to navigate through different systems that they had. They had a system called Marlin, and a lot of people use that system. Um, and I was just grateful for that opportunity. Coming across it on LinkedIn, I definitely encourage people to look at any jobs that they can on LinkedIn, especially if they want to build their public health resume. So it definitely was a resume builder for me, but I definitely benefited from working there. And I worked there for quite a bit during the pandemic. We did contact tracing. So we were really calling the people who came into contact with somebody with COVID-19. Um, so that was most of the work that we did there. And of course, we provided them with doctors' offices that they could go to, or if they needed to seek other clinical professional help, we were able to provide that for them.
Okay. Yeah, that makes sense. And that definitely feels like it's very aligned. And everything was COVID during the pandemic, especially the early
Yes,
days.
a lot of those jobs were like flying out there, and so I took a couple. But that job I thoroughly enjoyed because our direct supervisor was an epidemiologist, so it was nice just to speak with her, pick her brain, ask her different things that she sees on a day to day besides just working here. But it was a remote job, so it was very nice, very flexible, and I learned a lot from that.
Always a benefit, definitely. And you're
Hmm.
currently an adjunct professor at FSU, and you alluded to teaching
Hmm.
health policy early on. So tell us about that thought process and more about wanting to become an adjunct professor.
So like I said before, so when I was a little girl, I always wanted to be a teacher. And so being at FSU, getting this opportunity, was just like a whirlwind to me. Especially teaching health policy and society is the class that I teach. So I basically give my students the foundations on what is policy, how does policy affect people, who does it affect, what people are affected by certain policies. And then I also teach on the second half of the semester about social determinants of health. So I teach them how to look for SDOHs and how they can help people with their SDOHs when they go out into the community. Um, how does this environment affect these type of people and things like that. So I do enjoy the class that I teach. I teach Tuesdays and Thursdays, so which is pretty nice. Um, and so with this class and teaching there, I have like a huge impact on their education because I'm giving them the foundation principles. Being at FSU is very empowering to me, especially being a Black woman at a PWI has been a whirlwind because I'm able to leave my mark on that campus. During my time in grad school, and I have been leaving my impact on FSU. During my time during the program, I kind of like just pitched to them like, hey, I want to teach here. I want to teach here. And so they reached out to me and I was able to get that opportunity. And I can see myself in academia for a while, especially teaching at Florida State, because I know the program. I know what the students should look for when they go to the next level, because I do teach on the bachelor's level. So it's very insightful to give them kind of like a peek what to expect. And I do hold them at the standards of what a graduate program would hold them as, because some of them eventually want to go get their medical license, being a doctor or a DMP or anesthesiologist, or, the list goes on. So I do try to, give them some insight and, keep them on their toes in my class to, what to prepare for.
Yeah, and I think it goes back to asking what you want or just sharing what you want, because you never know what will come out of that. So shout out to you for like putting that out there,
Yes.
and then the universe also
A little
accepting that,
pitch.
and right. Yeah, everyone just create your little pitch and send it off to somebody that you would like to work for, an institution you like to work
Yes.
for, because you never know what will
And I
happen. You
had
never know.
Yeah, and I had great relations with the professors on campus, our program advisor. And that's why I'm saying, always network, because you never know the opportunities that you'll be able to afford. So it's always pretty cool to just, of course, they didn't have to pull out my records because, I came from that school. So it was just pretty cool to just be able to pour back into FSU how they poured back into me. So that's why I thoroughly enjoy this working there. And that's really why I chose to teach there.
You're currently also a community health worker and NHCI SMHP program coordinator manager at Bond Community Health Center. So
Cool.
how it is, and I think you alluded to kind of coming across this position earlier through another position. But how
Yeah.
did you come across it, and then what do you do in this position?
Yes, so I came across this job through my internship at DOH at Florida Department of Health. And so in this position, I actually have like kind of two roles. So I'm a community health worker. And when you mentioned the NHCI SMVP program, that's where I become the program manager. So as a community health worker, I'll start there first. I actively work in the community, and I basically am like the ear to the streets for the patients. So I basically connect patients that we don't have in our system yet. I bring them here, help them provide service. And then any patients that who are currently our patients, I make sure that they get what they need from their provider. So I make sure that all their needs are met. I also do providing education throughout the community. I also provide main essentials. We have a food pantry that I also help out with. So I do a lot of community work, and I try to make sure I connect myself to our community partners just so that I can be ready and available for when they need me to help our patients. And when I'm ready to need them, they can help our patients as well. When I switched my roles into the program manager position for the National Hypertension Control Initiative and Self-Measured Blood Pressure Program. It's through the American Heart Association. We were fortunate enough to get a grant from HRSA, and we were able to provide patients within our community who have uncontrolled blood pressure with a blood pressure machine. During the COVID-19 pandemic, a lot of healthcare providers saw that COVID-19 and high blood pressure were comorbidities of each other. And so that they saw that when people were diagnosed with COVID-19, they had severely uncontrolled high blood pressure. And most of those people that they were looking at were people that were, you know, mostly disproportionately affected by the healthcare system and weren't able to either afford or had access or even received quality health care. So with this grant, we're able to provide blood pressure machines in the community. So it's completely free. You do have to be a patient of ours, though, just so that we can monitor your blood pressure. But it is a remote patient monitoring program. So we can basically see the patient's blood pressure as they take it at home. So as soon as you take it at home, I get it on my computer just like that, like a text message. And every patient has specific goals within their chart. So if they're diabetic, their goal is like 130/80, or if they have don't have we split our program. So we have some patients are in that 130/80 range, or we have you in 140/90 range. The American Heart Association has changed like the national average that you should be, that 120/80, that has changed a little bit. So I encourage everybody to look at that and see where you categorize that. But that is the hat I wear with that. It's been very impactful to our community. We have really touched upon a lot of our poor zip codes. 32304 is a poor zip code here in Tallahassee. So we've made a huge impact controlling those blood pressure numbers in that community. And also with my community health worker positions, I provide free blood pressure checks to the community. So anytime somebody needs me to come out, I will provide that education and I will make sure that they get their blood pressure numbers that day. So it's always good to be proactive in the community. As the position that I am in. So I do love what I do. And I'm thankful that I did my internship at DOH because I wouldn't have this here. And I thoroughly love what I do. I've been here for about almost 3 years next month. So it's been really good. And I'm excited to see what we do next. We have a couple projects actually coming up. We have an HPV project. We're going to do it at the University of Florida. We have our food pantry. We're doing Patient Appreciation Day next month. So we got a lot of things coming up that I'm very excited about, especially as a community health worker, because I'm making a huge impact in my community.
That's cool. And tell me more, because you're working. It seems like you're working two roles in one role. How does
Yes.
that work out? Were you hired in as both a community health worker and a program manager, or did one come and then the other one kind of got coupled on top? How did that work out?
So because I had my master's in public health, and also because I showed great work ethic, I was fortunate enough to get another job on my first day, which was very cool. So I took on two hats my first day, just because my supervisor saw the potential in me. She saw my work ethic and how passionate I am about what I do. And because of my background experience in public health, I was able to afford both positions. And so I'm very thankful. And they both coincide with one another. One doesn't proceed over the other. Because with my community health worker, I'm able to get more people into my program and impact them more. So I'm really, working side by side with them.
Okay, that's interesting. And how do you manage that on a day to day? Is it like day to day you do half and half, or like some days you're doing more community health worker work program? Tell
I
us
am
more
doing
about that.
both at the same time. Because throughout the week we can go out into the community and I will have my community health worker hat on, or anytime I encounter somebody in the community, that hat is on. But when I'm at work, I can also see my patients, because my patients come in for follow-ups for their hypertension. So I wear both hats day to day, honestly. But it's very manageable. I have great planning skills. I don't procrastinate. I'm very proactive. I like to get things done ahead of time. So it's not too much of an issue for me to wear multiple hats. And I feel like in public health, you don't even just wear one hat. It's multiple hats.
Yeah, makes sense. Makes sense. Well, thank you for sharing that. You also started an Instagram account, Black Woman at Black Woman in Public Health. So be sure to go follow Taylor across on Instagram if you have not as yet. And then you also have the podcast. It's gonna start back next month. That's fine. Yeah. That's fine. once it starts back, that's all we care about across here. And you also started a Black Woman in Public Health podcast. So tell us about why do you start these platforms? What do you hope to get out of them, or like what do you do with these platforms that you started?
Yeah, so with both platforms, my goal is to provide a cost-effective way to share public health education and to eliminate disparities. So on these platforms, I basically share what is high blood pressure, what is diabetes, what is preeclampsia, what is COPD, what is asthma, or what is MRSA, things like that, especially because I come across day-to-day patients or people I just meet in the community that have a low health literacy. A lot of the things that I talk about on my page and my podcast are things that especially affect people of color. Is really the people I like to target, because a lot of people of color do not have the money to afford great healthcare like our white counterparts can. So I really wanted to start these platforms to get more information out there. It's cost effective. It doesn't cost anybody to scroll or to even listen to a podcast. So just by providing that information out there, I know I'm making my community a better place. And it also, continues to help my brain work also as well, especially in the public health field, because public health changes every day. So it forces me to read more. It forces me to think more. It gives me more of a skill set to break things down for people who don't have a great health literacy. I mean, it has a low health literacy. So just having both of those platforms, I'm able to share more information in a cost effective way.
Seeing the gap or the need for like more health literacy information, and then bridging that gap.
Right.
And I think as well as I appreciate, and I definitely agree with the fact that it forces you to like continually educate yourself so that you can continually share information, which I think is a good benefit, and it's something that you kind of lose when you leave school, is that you're like not really forced to read new information and things like that, unless it's like your job. But many times that I guess it just depends there, but I like that context of it, of like just being able to create content to help people and share information that people might not have had before. So for someone else that's out there that might be thinking about starting their own platform, what kind of advice do you give them?
Start when you're ready. Don't rush the process. And making sure that you have the right information. Don't Day-to-day public health already deals with a lot of hysteria in the news, so don't be another contributing factor to it. Just have the right information, because there's enough hysteria going around for people to pass on for forever. So just have the right information, time management, and just be passionate about it. Don't sound like a robot, like I'm just talking like this. Something like be passionate about what you're talking about. So that's really important.
Okay. And is there anything that people should be looking out for from Black women in public health, or?
Just stay tuned for the return. I'm very excited. I'm still doing some brainstorming of how I want to change up things. But definitely on Black women in public health, I'm definitely going to share more. I'm going to definitely have more IG series with some of my colleagues to talk about the ending ways of COVID-19. Also going to talk about more about this gun violence, about especially the new policy, that our governor enacted last month, and just talking about how we have seen a spike in gun violence. So things like that, I'm looking more forward to doing more IG series on my platform.
Awesome. Well, be sure to go follow her at Black Woman in Public Health, so you can see up Taylor when she starts back posting content. And yes, I can imagine the amount of stuff that you could talk about from Florida's perspective. So look forward to share to see more of that content. Hey, it's an opportunity to learn and grow. That's for sure. Okay, awesome. Yeah. So before I move you on to the Furious Five, I would like to ask you, where would you like to see yourself in the future?
To still be doing academia, getting my DRPH, which I plan to do next year. And I really hope to make a change within our healthcare system. Not so much maybe on the major level how Obama created the ACA, but maybe somewhere close to that, to provide more free opportunities, especially for people of color. But also, again, there is health equity. So I definitely want to make sure health equity is for all, but especially for my people of color. I want to make a good change with that. Because there's a lot of disparities going on, especially for our women. Women are dying dying during birth. So I definitely want to see a lot of change with that, especially within myself and within public health.
Yep, absolutely see that. And we look forward to seeing you go down that path and lead that career. So look forward to it.
Hey.
Yeah, moving you on to the Furious Five, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Do not get discouraged if your path moves slow, because it can. Not saying that it will stay like that, but do not be discouraged on the pace that you are going. And don't be discouraged if your colleague has greater opportunities than you. Something for you will come.
Love that. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
You cannot be in the position that I am in if you are not passionate about helping people, regardless of who they are. So they could be transgender, they can be black, brown, yellow, Indian, Portuguese, Jamaican, from any island, any country. Like, you cannot be in this position if you are not willing to help anyone. I leave that with my students. I tell them that all the time. Do not get into anything healthcare related, especially if you have a direct impact, if you are not passionate. That is something that that's always my advice for that.
Good advice. Number 3, what's something you are working on improving in your life right now?
Ooh, not taking on too much. I'm a person that likes to help a lot of people. So I do wear a lot of hats. I do help with some research that's going on. I help with my students. I help with myself studying for certifications. I'm looking to get into DRPH school. So don't take on too much that you cannot. I think that is just really important. But definitely do not leave out anything that you want to do. I'm very big on that. I definitely want to fulfill everything I can within this position. But it can be a little much when you take on too much.
Yeah, makes sense. I think healthy boundaries is always a challenge of people
Yes,
that want to
that's good.
help
Yeah,
people.
healthy boundaries.
Number 4, professionally, do you recommend anything?
Professionally, get all the certifications that you can from your university, especially if it's free. I had so the difference between the program I went to, SAS wasn't required, so statistical analytical software. Most jobs require that from you. Also SQL, if you can get that as well. Get your CPH, get your chess. A lot of schools pay for those, so look at every opportunity that you can to get for free. Because life is expensive, especially when you graduate, you have your loans. So definitely utilize your school for everything that you can. And especially if you can go back to work there and get tuition reimbursement or something like that, definitely do that, because, they can give you opportunities to get, something added as another credential. Project management, I encourage people to get that as well. That's been a big thing that a lot of people are asking for. So definitely map out what you want to do career wise, and then look at all the certifications or degrees in between that you can get so that you can further advance your career.
Absolutely. And then last but not least, where can people connect with you, Taylor?
Alrighty, so I will share my email if anybody would like to reach out to me. So it is Taylor, TAYLOR, the number 1 dot HUMPHRIES at gmail.com. You can also find me on LinkedIn. It's Taylor Humphreys, MPH. You can also find me on Instagram at Black Woman in Public Health. And you can also find me on Apple's podcast, Black Woman in Public Health. And with my Black Woman in Public Health platforms, I will be starting next month in August. So within a few days, you will start seeing more posts about general education. And then we'll also be starting an IG live series also next month as well.
Awesome. And this episode will be coming out next month in August. Well, you listening to today, so hold Taylor accountable. If you're listening to this and you follow her, just check in and say, hey Taylor, where's that content you said you're going to post? So appreciate that. Yeah, but thank you so much for coming on.
Thank you so much.
Yeah, truly is my pleasure.
Because you are very impactful with your series, because you just sharing this information, interviewing different people and seeing their walks of life, it definitely encourages people to not get discouraged because everybody's path is different. So I really do appreciate you and give you your flowers for, doing this.
Well, thank you so much. I appreciate that a lot. And yeah, cannot do it without wonderful people like yourself being willing to share their stories and their vulnerabilities and perspectives. So I appreciate you coming on and
Yes.
sharing and adding to the archives of great stories that people can listen to and relate to and take with it and grow in their public health career.
You're welcome.
Yeah, so housekeeping items, everyone. Thank you so much for listening or watching this. Be sure to subscribe if you have not as yet. Be sure to leave a like if you're watching it on YouTube and leave a 5-star review or any kind of review. Let us know what you think of the show and share it with a friend. That really helps the show get out to more people and helps someone else navigate their public health career. So be sure to subscribe, like, and share it with a friend. Well, leave a review as well. Peace, everyone.
Thank you.